Okay, we are going to start off with the muscles, and first off is the supraspinatus. The action is going to be adduction of the arm, first 15 degrees, and stabilizes the shoulder joint. The origin is going to be spinatus fossa of the scapula, and the insertion is the greater tubercle of the humerus. Okay, next is the infraspinatus. So the action is going to be externally rotate the arm and stabilizes the shoulder joint. The origin is going to be infranaspis fossa of the scapula, and insertion is greater tubercle of the humerus. Next is the teres minor, and action is externally rotates the arm and assists in adduction. The origin is going to be the lateral border of the scapula, and the insertion is going to be the greater tubercle of the humerus. Next is the subscapularis. So the action is going to be internally rotates the arm and helps stabilize the shoulder joint. The origin is going to be subscapular fossa of the scapula, and insertion is the lesser tubercle of the humerus. Okay, next is the rhomboid. First is the action, and it retracts or pulls back and elevates the scapula and helps to stabilize it. There's two origins, the rhomboid major, which is the spinous process of T2 to T5 vertebrae, and the rhomboid minor, which is spinosus process of C7 to T1 vertebrae. And then the insertion is the medial border of the scapula between the spine and the inferior angle. Okay, next is the pectoralis major, and the action is going to be adducts and internally rotates the arm, which also assists in flexion of the arm. The origin is going to be the clavicular head, anterior surface of the clavicle, and the sternocostal head, anterior surface of the sternum, and the cartilage of the first 6 ribs. The insertion is going to be the lateral lip of the bicipital groove of the humerus. Okay, next is the pectoralis minor. Now the action is going to be pulling the scapula forward and downward. The origin is ribs 3 to 5 near the costal cartilages, and the insertion is the coracoid process of the scapula. Okay, next is the biceps brachii. The action is going to be flexes the elbow and supinates the forearm. The origin, the long head, is supraglenoid tubercle of the scapula, and the short head is coracoid process of the scapula, and insertion is going to be radial tuberosity of the radius. Okay, next is the triceps brachii. The action is extends the elbow. Origin, there's 3. So the long head is going to be infraglenoid tubercle of the scapula. The lateral head is posterior surface of the humerus, which is above the radial groove, and the medial head is also the posterior surface of the humerus, but instead of above, it is below the radial groove. And lastly is insertion, which is the olecranoid process of the ulna. Okay, and lastly, we have the brachiodoralis. The action is going to be flexing the elbow. The origin is the lateral supracondyloid ridge of the humerus, and the insertion is the styloid process of the radius. Okay, so we are now going to move on to pathologies, and our first one is the impingement syndrome. So the pathology that's going to be used for this is the compression of the rotator cuff tendons or subacromial bursa of the shoulder. The mechanism is repetitive overhead motion, or poor posture narrows down the subacromial space. The common structures are supraspinatus tendon and the subacromial bursa, and the special test would be the Neer's test, the Hawkins-Kennedy, the painful arc, or the empty can. Okay, so next is going to be the rotator cuff tears. The pathology is going to be partial or full thickness tear of one or more rotator cuff tendons, most commonly supraspinatus. The mechanism is acute trauma. An example could be falling or a fall, or chronic degeneration from overuse of impingement. The common structures would be supraspinatus, infraspinatus, subscapularis, or teres minor. And the special test would be the drop arm test, the empty can test, or the external rotation lag sign. Okay, so next is going to be the biceps long head tendonitis. The pathology is going to be inflammation of the long head of the biceps tendon in the bicipital groove. The mechanism is repetitive overhead activity or shoulder instability. Common symptoms are anterior shoulder pain, tenderness over bicipital groove. And special test would be the Speeds test or the Jurgensen's test. Okay, next is going to be anterior shoulder dislocation. So pathology would be head of humerus dislocates from the glenoid cavity anteriorly. The mechanism is going to be forceful external rotation and abduction. An example could be during a fall or a tackle in football. Common injuries may involve a labrum tear, the Bankart or Hill-Sachs lesion, and special tests could be the apprehension test or the relocation test. Okay, next is going to be the glenoid labrum injuries. So the pathology could be the tear of cartilage ring, the labrum that deepens the shoulder socket. Next, the mechanism, repetitive overhead motion or trauma, example dislocation or fall. Common types is the slap tear top, or the Bankart lesion, which would be a front interior. And special tests could be O'Brien's test, Crank test, or biceps load test. Next is going to be the acromyoclavicular separation. The pathology could be injury to acromyoclavicular, the AC joint, ranging from sprain to complete separation of the clavicle and acromenoid. The mechanism is going to be a direct blow to the shoulder or fall onto an outstretched hand. Grading, the grade would be a mild sprain to grade 3, which is a complete separation. 1 would be a mild sprain. And then the special test could be crossbody adduction test or a piano key sign. Okay, next is going to be the carpal tunnel syndrome. So the pathology is going to be compression of the median nerve within the carpal tunnel of the wrist. The mechanism is going to be repetitive wrist motion, prolonged pressure, or systemic conditions. An example could be diabetes or pregnancy. Some common symptoms would be numbness, tingling, weakness in the thumb, index, and middle fingers. And special tests would be the Phelan's test or the Tinel's test or Tinel's sign. Okay, so next is tendonitis, and the pathology is going to be inflammation of a tendon due to overuse or repetitive motion. The mechanism is going to be repetitive strain or sudden trauma to micro tears in the tendon fibers. Common areas could be the shoulder, which is the rotator cuff specifically, elbow, tennis elbow, the knee, patellar tendonitis. So yeah, and some special tests would be the Cosen's test for tennis elbow or the Neer's test for shoulder tendonitis. So some sprains of the wrist and the hand. Pathology would be stretching or tearing of ligaments in the wrist or hand. Mechanism would be trauma such as a fall onto an outstretched hand or direct impact. Common areas would be the scapholunate ligament, collateral ligaments of the fingers, and triangular fibrocartilage complex. Some special tests could be the Watson test or the Ulnar variance test. So next is going to be the ulnar nerve contusion. The pathology is going to be bruising or compression of the ulnar nerve, often causing temporary dysfunction. Mechanism would be direct trauma or repetitive pressure of the ulnar nerve, which an example could be hitting the funny bone. Common symptoms is going to be numbing, tingling, weakness in the ring and little fingers. And then special tests would be the Tinel sign at the elbow or the Frohman sign. Next is going to be the epicondylist. The pathology is inflammation of the tendons at the elbow, often due to overuse. Mechanism is repetitive motion causing micro tears in the tendon attachments at the epicondyles, lateral or medial. Types are going to be lateral, tennis elbow, and medial, golfer's elbow. And then special tests could be the Cosen's test, the golfer's elbow test. Okay, and our last pathology is going to be the olecranon bursa. So the pathology would be inflammation or swelling of the bursa over the olecranon elbow. Mechanism is going to be repetitive trauma or pressure. An example could be leaning on the elbow or an infection. Common symptoms would be swelling, redness, pain at the back of the elbow. And some special tests could be the physical examination for swelling, tenderness, and warmth, but there's no specific special test. Okay, now we are moving on to bony landmarks. First is going to be the clavicle. So this bone right here, all across here, it is going to be right here, and as you can tell, the bone is right there. Okay, next is the humerus, and it is in between the ball and socket joints, but it's going to be right here on this bone of the shoulder. Okay, next step is going to be the radius and the ulna. So the ulna is going to be on my right side of my right arm, and I know that because it's on my pinky side, so it's going to be here. And then the radius is going to be on my left side of my right arm, and it's going to be the bone here. Okay, lastly is the scapula, and I can't show it perfectly, but right here, the bone that runs all across here, and then the one that runs down too, it's where they meet.